Go ahead and turn it on right there, and now we are recording. Great. Shannon, would you like to start, or would you like me to start?
Yes, I am Shana Klassen. I work at the Oklahoma State Department of Education. I'm the Director of Health and PE, and this next year I will be the project manager for the CDC supplemental grant for COVID. So I will be working with Caney, Colbert, Medill, and Rock Creek with that project. And so we're really excited to be talking to Trevor and his team about Teams Clinic and with the possibility of implementing Telemed into your school districts to kind of just help fill that gap sometimes that we have in public schools with in relation to school-based health services. Because a majority, I believe 1 out of the 4 schools that I'm working with has a school nurse. And so that is the reality of a lot of small schools. And so we're really excited to hopefully, provide that support that you need in that area with Trevor and his company. So I've heard a lot about Teams Clinic through meetings with Trevor. So I'm excited for you all to hear about those possibilities. And so I will turn it over to you, Trevor.
Okay, great. Thank you very much, Shannon. Well, just real quickly, I'll kind of give you just a real quick background of kind of who we are and why we do what we do. We started about 3.5 years ago at a fundraising gala that I was at with some high school principals. And during this fundraising gala, I happened to be sitting next to these 2 gentlemen who I knew and kind of were family friends. And they just described to me for a couple of hours a lot of the issues within the public school system. And at that time, my kiddos were younger. And I wasn't aware of, sorry, let's close there we go. A lot of the issues they were describing, I wasn't aware of. And specifically, they related to the healthcare industry, something I've been in for getting close to 20 years now. And so at the end of the evening, they kind of quite frankly looked at me and said, "Hey, is there anything you can do to help us around this?" And I said, "Well, let me think about it." And so I spent about 6 months thinking about it and coming up with a plan, some ideas on how we could provide services in the school districts that the school districts just needed, because the students they were seeing and many oftentimes the families they were serving weren't getting. And so after about 6 months, I went to them and said, "Hey, I got a plan, and here's what we can do. Here's how we can do it." And so we kind of started there, and we just started rolling it out and recruiting more providers and expanding our services and trying to get the word out that, hey, if you have kiddos or families in your community that you serve that could benefit from these types of services, we'd be here to help serve you and help support you to do that. When we started, it was primarily with urgent care or primary type services. So think about strep throat, flu, lice, ear infections, things that you might take your kiddos to go see an urgent care or see your primary care physician type stuff. Through that experience, it became very clear very quickly from the feedback that we received from our districts and as we describe our customers, our nurses and our superintendents, that, hey, can you also do this? And the, hey, can you also do this conversation became a very large conversation, and it expanded pretty quickly to, well, we can see lice, that's great. Can we also do behavioral medicine? And we said, well, tell us what that looks like. How big of a need do you guys have? Explain, talk to us about that. And through just that type of conversation, 3 or 4 or 5 different services became clear that, hey, this is a significant need that we have. And it wasn't specific to one district or one location within a district. It was really all of the districts we spoke to. We'd say, okay, great, here's what we do. Would this help you too? And all of them were like, oh my gosh, can you do that also? And so we said, well, this is probably something a real need. I mean, we ask enough, and when you get 100%, in my experience, when you get 100% of your customers saying, yes, this is something we need, that's something you need to offer them. And so just this year, meaning starting for us tomorrow, we have 2 districts that are starting tomorrow, and then we have 4 or 5 that are starting next Thursday, and then we have a couple more that are starting a week or so after that. But for us, so the 2020 school year, we'll continue to offer the urgent care and primary care type visits. We're going to be offering behavioral medicine or behavioral health. We're going to be offering counseling services, occupational therapy services, physical therapy services, and speech therapy services. I have a document I'm kind of glancing over to that we just sent out to all of our current districts that I'd be happy to share with you guys after we finish. If you have an interest, I'd be happy to have Melissa share that over to you guys, and you can take a look at that. And it kind of talks about the services a little bit and some of the new things we're trying to do and to help support you guys even more. But our goal as Team Clinics is to support you guys in the schools first and foremost. Through my initial conversation with the principals, and then all the subsequent conversations that we've had as we just tell people about what we do, or we're introduced to folks like you guys from folks like Shana, is we want to help support you guys, because you guys are doing what we learned was you're not just educating kids. Most of the time, the word that, or the term that I was introduced to was community schooling. You're providing so much, and obviously this pandemic has exposed that even more, between nutrition, education, some of the things we talked about, some of the medical stuff, some of the kiddos that we see, the only medical people they have in their life are the school nurses that they see, among other things. You guys generally are some of the first people to report abuse. My wife and I have been foster parents for several years, and just last December adopted 2 kiddos, 2 sisters that we had that were foster care kids of ours. And we learned very quickly that the kiddos that are in school are the ones that end up getting protected a little sooner, because they're in school and you guys are seeing them, and the teachers are involved, the principals are involved, people see it and they say something. When they're younger and they're not in school, that doesn't always happen. The girls we had we got them when they were 1.5 and 2.5, and that wasn't being reported because they weren't around anybody to do it. So it hit home for me pretty hard because of our own experience, and then just learning about more of the kiddos we see and things we get to do. When we built this, there wasn't something out there that we could just go plug in, and so we had to build it ourselves. So we built our own platform to provide the telemedicine services. We also built it knowing that you guys are flush with cash. You have a bunch of extra budget laying around, and it's just easy money, easy pickings. We built it to where it wouldn't cost the district anything for us to be with you. We provide the medical equipment, we provide the testing equipment. There are a few things that the school district has to have, like they have to have internet access. We're very fortunate that our state legislature believes very strongly, and has for a long time, and our companies here in Oklahoma have done a good job of getting most of our school districts broadband access and a really strong network to run the internet. And so every district we've been in, from Jay Public Schools in far northeast Oklahoma to out west, all the way to Woodward, Elk City, Clinton area, they all have great internet access. I'm going to stop for a second because I have one person who just joined, Sherry Brown. I'm going to let her in here. Give her a second to get connected. Hi, Sherry.
Hello.
How are you today?
Doing good.
Good. This is Trevor Nutt. I'm with Team Clinics. Sherry, where are you from?
I'm from Caney School.
Caney. Okay. And your role at Caney is what?
I'm actually the school counselor.
Okay. Great. If you don't mind, we kind of jumped into it just a few minutes ago, so I'll continue that. Do you mind if I just put you on mute so that we don't hear sound like you're driving down the road maybe or something?
Yes, I apologize for that.
Oh no, that's okay. No, you're a busy person. No apology needed. When I finish, we'll open it up and unmute everybody and give everyone a chance to ask questions and talk and go from there. Does that sound good?
Perfect. Thank you.
Okay, you bet. Glad to have you. So we provide the medical equipment, we provide the testing for flu or strep throat or in now which will be COVID. That's all stuff that we provide. The school district doesn't pay us anything for us to be there. The way our business model works is we bill insurance, and so when we see a kiddo or a staff member, we have an app that they use to register themselves with and get us their information, and then we communicate directly with them, and anything related to insurance or financial, anything like that is on us, and we handle that outside of the school. And we have that conversation directly with the guardians or the parents of the students. We find that the locate when we started as urgent care, we found the need pretty significant. And now that we've opened up these others, the conversations that we're having are just really, really exciting, because we're hearing about the need, and we're hearing that, hey, we can help fill the gap where kiddos are not getting services. Any district or community that we go into, our goal is to be able to provide the services to the kids who aren't getting it. We encourage and would love to have community support from the local physicians. We would love for the local community physicians to join us and be a part of our platform and see the kiddos in Okmulgee. If there's a pediatrician that for example, Superintendent Dove, if there's a pediatrician in Okmulgee that would love to see your kids, and they have the space in their practice to see them through telemedicine, we would love for them to be a part of what we're doing, and they can come in and be a primary person doc for you guys, and see every one of your students that need to see a primary care physician for whatever the service is. That would be great. We believe that a community-based healthcare system is best. We think that the students who can go down the street and see the doctor is better than having to do it over telemedicine. But what we also believe is that having telemedicine is better than having no doctor or no provider available. And we all know that, having been in the healthcare business for many, many years now, seeing the move from physicians and providers generally out of more rural areas, smaller communities, back into a larger urban area is just what's happening, or is what's happened. And so we're seeing fewer and fewer providers in the smaller communities, or at least they're less. We don't want to, we're not here to take their business. We're not here to not have them see students. We would love for them to join us and be part of seeing this, who these are. So as we go down this path, if those are things that, if this is something that you think after I'm done, that you think, hey, this is something that could help, that'd be something we would love to have a conversation about and get us pointed towards the right position or provider group in your area and have a conversation with them. We'd love to do that. So please make sure you hear me say that we're not exclusive. We want to include them. I'm also going to say this though, every district that we've gone into, or every community we've gone into so far, we've not had any that have chosen to sign up with us. And I think it's kind of been for several reasons, but the primary one that we see, or that we hear from them, is, hey guys, what you're doing is great. That's awesome, but I'm so busy, I don't have time to see more kiddos, more people. My schedule's full. And so hence the reason we're there. Right? I mean, if they're full, then let's bring in some more folks that can help see them. And when we have specialists that we need to get involved, whether it be dermatology or orthopedics or urology or whatever, those are new services that we're going to be bringing on also to give specialists access, or give the students and the staff access to those specialists if and when those are needed. But right now, let's get them diagnosed with, I just real quickly, that we had a student who the parents were just, they were, I would describe it as embarrassed that their kiddo was dirty. Well, their kiddo wasn't dirty. Their kiddo had eczema. And when you have eczema, it was so bad that some of it had become infected because he would scratch at it all day. It would drive him crazy. Well, he can't learn. He can't do anything when he's itching that bad. And so you get him a few things prescribed, and we see him in 2 weeks, and it's under control. And we explain to mom and dad that, hey, it's not because you're not taking care of him. It's because he has a skin condition that is legit, and we need to help. We can treat it with these things. Now, can you keep getting the prescriptions to help him get there? So those types of things are often where we step in. Around behavioral medicine and behavioral health, that's the one that we're probably seeing the greatest response from our districts right now is behavioral medicine, behavioral health. You guys, students often aren't allowed into class or into school unless they're on their meds, if they've been diagnosed and they have that. Unfortunately, there's a massive shortage in adolescent and child psychiatry, and getting kiddos to see those providers is very, very difficult. Most of the time it's because of the distance they have to travel to get there, number one, and number two, it's the availability of a schedule being open for a psychiatrist to see them. And so we've hired a psychiatrist, child and adolescent, or we've hired a provider that specializes doing child and adolescent psychiatry, and he's available to us when we need him. And that's what he does. He loves taking care of kiddos. He kind of looks like Santa Claus, and the kids love him. He's got great bedside manner. And so we've opened that up to provide it. And we're hearing from the parents that, I have to take off half day of work to take my kiddo to go see the doc, who we see for 10 minutes. And they ask him, how's it going? We say, fine. And then we leave. And now he's missed half day of school. And so what we've been able to do is transition from that to the visit takes 20 minutes, 15 minutes in school. The kid never leaves. The parents can stay at work or wherever they are. We bring them into the video chat. We see the student. The psychiatrist talks to them. We go through the process with them. Hey, how's it going? How are you feeling, mom and dad? What's this looking like, et cetera, et cetera. And at the end of the visit, it's, hey, everything's great. Okay, great. We'll go ahead and fill your prescription again for the month. And we'll see you next month. We'll go ahead and schedule it, and we'll see you on the third Thursday of next month at 9:00, and it's ready. We just heard again and again how helpful that has been for some folks. And so that we're excited about that, because we're seeing benefit, and the schools are seeing benefit, the parents are seeing benefits, the kiddos are being served, and it seems to be helping. So that's kind of in a nutshell who we are, and why we exist. We're excited for the opportunity to serve more people, and where there's a need, we'll be there if we can. And so, let me, Shannon, let me ask you, as I kind of covered that so far, is there anything that you and I have talked about that I left out that you'd like me to touch on before we open it up to everybody?
I don't know if you want to go into, you did talk about the schools needing internet connection, but you haven't really talked too much about the telepresenter and that point person for each school.
Sure. So when we're doing a primary care or urgent care type visit, we have to have what we call a telepresenter, and more often than not, a telepresenter is a school nurse. And a school nurse is either a registered nurse, who's the school nurse, or is a health aide, or some other person that's been designated by the school that is their lead person for medical stuff. We've had some districts that try to do it with a secretary. And our experience has been that the secretary is generally pretty busy already. And then to ask them to do this on top of the fact that they don't have any medical experience, it just doesn't work. And when we say it doesn't work, what that means to us is that utilization is not done. There's no utilization. And the reason we determine it the reasons we say, well, it doesn't work if there's no utilization, is because if there's no utilization, the students aren't benefiting from it. And if the students aren't benefiting from it, then why are we taking up space? Why are we doing there if there's not going to help who we're intending to help? And so we tried that a few times. And we were willing to give it a shot, and we just learned that it just doesn't work. For urgent care and primary care, you really have to have, and really for behavioral health even, we have to have a telepresenter, because they have to be the person who intakes the kiddo, determines that yes, there's going to be a need for a visit to be seen because of the protocols that we set in place, that we normally work with the schools on determining with our chief medical officer. And we set up protocols that say, kind of a little flow chart. If this, then that, and the kiddo get assigned a test and their stomach hurts, well, they probably don't need to see us. They probably need to, go back to class and do their test and take their medicine that they didn't study for. So we have to have one for that. Now, as we get into counseling and occupational therapy, physical therapy, and speech, we believe that we won't need a telepresenter for those, because those therapists will actually be the telepresenter. They will have a student that is their student for counseling. Let's just use that example. Their counselor is going to see that student once a week, and they know they're going to see that student every week at 9 o'clock on Thursday, and the student comes down to the session, and they just turn it on and they're off and going. And that's a regularly occurring, regularly scheduled visit time. Sometimes the parents will be involved, sometimes they won't, but that's up to this therapist and how their counseling session is going to go. And so there'll be a much less need for a telepresenter in that scenario than when we're doing things like lice. When we're doing an evaluation for lice, we call it a derm scope or an otoscope, where the telepresenter is going to use it and actually point it right on their head, and they're going to look around on the video screen and see that, okay, there's those little nits and they're bouncing around, and the provider's going to see that, and they're going to say, okay, lock the room down and let's get them treated. The student can't do that themselves, and we know the parents aren't going to be there, so that's where the telepresenter comes in. And obviously, if we were to think about a COVID test, that's obviously the hottest thing that we're talking about right now is COVID testing. We've got to have a telepresenter that's going to be wearing PPE gear that is going to do the COVID test, and they're going to run it, and they're going to report back to the provider and say yes or no. And then, if it's no, we have to report that. And if it's yes, we have to report that. And we have to have someone to help us manage that process. So, Shane, that's a good question. And thank you for bringing that back up. Shane, anything else that I missed so far?
The enrollment and/or the online training modules that you have available.
Okay, so we like to do what we call pre-enrollment. So when we come into district, we like to be able to launch our product to you guys and do what we call a co-branding with you guys, where we kind of ride your coattails as the district, because when we're with you and you say we're okay, then we gain a lot of credibility just by being in the building with you guys. And as you guys communicate with your parents and say, hey, we've partnered with Team Clinics and here's what they do, that helps get the word out that, hey, we've got a new service for you guys that need it. And we like for them to go ahead and sign up with us and register themselves on our platform, so that when they do need us, then we've already got we probably got 90% of the information that we need generally. That's not a deal breaker. And if somebody shows up in the nurse's office and they've got lice, for instance, the parents are going to have to go on our platform and register themselves, put in their information, take a picture of their insurance card, take a picture of their driver's license, and kind of upload that stuff. And all it basically does is extend the visit by about 10 to 15 minutes. If they do it beforehand, then it saves 10 to 15 minutes. The online training, as Shanna just mentioned, we the last 2 years we would come on site and actually do physical training with your nurses. We had a gal that worked with us that would come on and teach them about the medical equipment, the stethoscopes to listen to their heart and lungs, the otoscope to look at their skin, to teach them about our electronic medical record, which is the nurse will be working in, all those things, how to do testing, how to do COVID testing, how to do strep testing. They would come on and actually do that. When you do 1 or 2 districts with a couple of locations, that works pretty well. When you do 50 or 100 locations, that doesn't happen, because all of you guys start within about a week and a half, generally about a week of each other. This year we're except for this year, everyone starts usually about a week of each other. So we said, okay, we need to pivot here, and let's do an online training system called a learning management system. You guys are familiar with learning management systems. You probably have used them in some way, shape, or form at some point. And basically, we took all the stuff we do online, or we would do physically, and put it into modules online, and created the videos and the documents for your nursing team to watch and to do, and then take a little quiz on it saying that they watched it and they did it and they understand. And then they're approved to use our system. They're approved to be in our EMR system. They're approved because we have a HIPAA training. Then they're approved to be a part of our system. Because when your telepresenters or our therapists are seeing your students for us, they're covered under our malpractice insurance. They're covered under our blanket, if you will, our umbrella. And so we have to have documentation showing that, hey, they've met our standard and they are covered by us. And so that's what our learning management system is now doing. We actually just launched it last night to our first district, and Melissa's going to be launching it to several more this morning, and then some more next week, and then a little bit more later to get everybody up and trained on how to use our stuff. We think it will be easy because they're going to be able to have that information available to them at all times. I mean, they'll just log into our platform and they'll be able to see their little library of stuff, their videos on, if they forget how to do COVID testing because they haven't done one in 2 weeks, then they'll just go in and open up the video on COVID testing and review that. It takes a couple of minutes for them to see, okay, I do this, yep, okay, good, boom, done, and we're off and running. If they forget how to, how do I use the EMR system again, they can go in and they can review that pretty simply, pretty easily, and then be off and running. And so we're excited for that, to give you guys and them greater access to that information at a finger's touch. The other piece of that, dude, we also are in the process of hiring, and we hope that she's starting here this week, if not Monday, is we're hiring an account manager that her job is going to be to talk to your nurses as often as they need. Text messages, phone calls, video chats, whatever it is that they need for support. They have questions. She happens to be an APRN, which is a nurse practitioner, who has been doing telemedicine for some time now. And we're excited for her to be a part of our group because she's going to be able to speak the same language that your nurses and telemedicine or telemed presenters will be able to do. And they'll be able to have conversations and really be a support system for your team on the ground, seeing the students. She can be someone that they can bounce things off of. They can have questions about, that gives them direct access to our team on a medical side and be able to help them see students more efficiently. So that's our LMS system, and we're excited about that to provide more services.
Trevor, could you tell them about the timeline of getting Teams Clinic set up, if that is the direction they want to move?
Sure. To get started takes somewhere between 4 to 6 weeks for us. Once we have an agreement signed, it takes us about 4 to 6 weeks to get all of our paperwork and all of our documentation and all of our credentialing done, and all the things that we have to do to open up a clinic in your district. It takes us about 4 to 6 weeks. Sometimes it happens a little faster, but I like to say that to be a little conservative. And then when we come in a little sooner, you guys smile at me because we're there quicker, versus it taking us 8 weeks to get done. So about 4 to 6 weeks is what we're kind of seeing. And then we're ready to go. That includes training for your nurses. That includes equipment being installed. That's the whole thing. And in 4 to 6 weeks or less, you'll be ready to turn your system on and ready to go. Things that we would ask of you guys during that time would be things like, hey, if there's an occupational therapy need in your district, and there is an occupational therapist that either you are paying currently, the district is paying, and you would like for us to employ them, meaning they would come off of your payroll and they would come over to us to be contractors for us and then see your students, then I would want you to share that with me, and I'd want to start that conversation with them. Those folks that are doing that are coming in your schools are doing that work already. We want those folks to stay engaged. We're not trying to take their job. We're not bringing in a whole bunch of occupational therapists and kick them out or anything related to that at all. We want to maintain services. We want to increase those services available. And if they're already coming on site and they're already seeing your students, they can come on site and see your students through team clinics and still come on site. If they say, hey, I want to come on site twice a month and I want to do telemed twice a month, they have that flexibility to use our system either way. They can come on site and use team clinics and see them just like that, and they'll chart in our system just like they're charting now, except it'll be in our EMR system. And we'd be able to shift their expense, if you will, from your budget over to us, and then we would then pay them. If you have occupational therapists that you say, hey, we want to keep what we're doing, we would say, okay, great. What needs do you have? And you said, well, we only have urgent care and behavioral medicine. We'd say, okay, great. We can provide those. When do we need, who do you have? What students do you have? What staff do you have? We want to be seen and utilized as a tool that you guys use where you need to use it. if you don't have a need for occupational therapy, then Team Clinics doesn't provide occupational therapy. It's really your request. It's your desire. If you say, hey, we want to do occupational therapy, and then in 6 months you're like, hey, it's not working, we don't want to do it. Okay, great. Then we stop. We want to be a support system to you based on your need. If you have a need, if we can fill it, we will. But we do that together with you, and at your request. If you don't have a need, then we don't. So I want to make sure I'm conveying that if we can help, we want to help, and if you want us to do that, we can. If you don't, that's okay too, and we won't. We'll provide as much or as little of that support as you guys want us to support. If you say, hey, let's start, but I really want to kind of start small and let's start with this one little thing, and we say, okay, great, we'll start with that one little thing, and then if that goes well, if you want to do more, then you call me and say, hey, we'd like to do more. Okay, great. Let's do that. We're open for that. We're great with that. We want to support you guys the way you need to be supported. So, timeline, roughly 4 to 6 weeks.
I think that's all I have on my notes, Trevor.
Okay, great. Why don't I do this? Why don't I think you guys can unmute yourself, but I will unmute you. I'll see if I can unmute you guys. If you have questions, would love to hear from you guys. What I'm doing is pushing the ask to unmute, and so you may have something show up on your screen that says yes or no. So why don't I open up to the floor and see what kind of questions you guys have, if any, and we'll go from there.
Okay, Trevor, I'll ask.
Okay.
I think I understood you to say that in the Telemed that we have students in our district that have to see the doctor every month or call in to get their script filled because of just the level of prescription that it is. So they could use this service to do, and oftentimes they wait, it slips up on them.
Yep.
Or they don't have transportation, or it's the end of the month, and all of those reasons in a rural area why the kids don't get their meds. So we have a delay of a week to 2 weeks that really is hard on the child, it's hard on the family, it's hard on everybody involved in that child's life. So in Telemed, the school nurse or whoever that person is designated to be in there the parent sets up the appointment, and the doctor sees them, or
Yep.
Telemed takes care of that and gets that script refilled in a timely manner, and
that's right,
and helping to get that medicine picked up.
That's exactly right.
Okay.
That's exactly right.
That's one of the biggest things we see, is that every month there's a delay in medicine, especially if it's a narcotic, and you have to have that every month. And
that's right. Yeah. So those are called class 2s is what those are called. Kind of the acronym. It's not an acronym, but they kind of shorten it to this class 2. They call them class 2s. So if you write a class 2, those students have to be seen every month, and there's other specifications that we have to follow as a provider. But what you're seeing is the students that aren't on those regular visits. They're not, like you said, for all the different reasons you mentioned, and I'm sure there's others. They're not going to see the provider, and then because they're not seeing the provider's not going to write the class 2 prescription because he or she is prevented from doing so legally, and so they're not getting their meds. And so in our system, what we like to do and what works great is you guys identify those students, and you tell the parents or the guardians, hey, we now have Team Clinics. This is what it does. They have behavioral medicine. We can do behavioral med here at school, and let's shift you over to that. And then what we do is we basically bring them into our practice. And as we bring them into our practice, they become a patient of ours. And as a patient of ours, then we see them. Every time we see them, what works best for those students is we set up a schedule or appointment for the following month. Hey, Johnny, little Johnny and Johnny's mom, we're going to see you next Thursday, or every third Thursday, we're going to see you at 9 o'clock in the morning for your prescription. and we're going to see you and see how things are going. And if things are going great and you're not losing weight and, you know, mom says everything's kind of good and the kid's feeling good, then we go ahead and refill that prescription like we're asked to, or like we need to. And then we see them in another month. And if it's something changes in that month, or if it's less than a month and mom calls, and she can connect directly with us, or she can go through the school nurse and say, hey, little Johnny, something's wrong. He's not feeling good. He's lost 5 pounds and we need to get in. Okay, great. Then we go ahead and schedule it. First available, go ahead and get him scheduled within a day or so generally. And let's get him in and seen. And we jump on and, okay, Johnny, what's going on? Adjust the meds, write the new prescription. And then mom goes and picks it up wherever she asked us to send it to.
Sorry, I have the principal start calling, and I thought there was an emergency, but we're all good. Okay, so you may have said this already, but in that, so after everything's established, the parent can be at home on a device, and the child can be at school, and they can have that appointment, and everybody still be there. Correct?
That's correct. That's right. Yep. And I would say probably in behavioral med, after they're established, probably 80% of the time, the parent or guardian is at another location, and we're seeing the student. Some of that depends on the age of the student. The younger they are, generally, the more often the parents are at the school. As they become a little bit older, then the parents, we find they don't come to the school. Especially what we really find is after about 4 or 5 visits. I mean, we have a lot of parents say, hey, just take care of it.
That's what I figured.
Like, okay, hold on. Okay, well, just take care of it. What does that mean? You got to be part of this, right? We can do our part, but you got to be involved. You know, I mean, you got to tell your parents the same thing. So, but yeah, they can be where they are. We've had them at home. We've had them at work. We've had several that are driving down the road as a passenger doing the visit, and they're, you know, talking back and forth. And so it's been all kinds of different pieces.
Okay, and you said students and staff is also eligible for this?
Yes, ma'am. We want, what we tell our folks, our customers, our districts is, hey, we will see whoever you want us to see. So we have some districts who have opened it up to the community. I mean, they're very aggressive. They want to do that. And so we're happy to do that. Now, the parent, the patients, they have to still follow they have to go on our platform, they have to sign up, they have to do the thing that they have to do, right? I mean, they have to do that, but we want to be a support system to you guys. So if Superintendent Dove says, hey, I want only students to be seen at teen clinics, then we just see who you present to us. If you say, no, I mean, the staff would benefit from it because, you know, I've got teacher Nancy that is not feeling great and she'd like to come down during the planning period and be seen for, you know, a UTI or a strep test or whatever, then she comes and great. Teacher Nancy sits down and we're like, hey, Teacher Nancy, how's it going? You know, we do the visit. It's really going to be up to you guys how you want to use us to support you guys and serve your community. If you want to do that, we would love it. And I'll tell you this, we are shocked. Well, shocked is probably a little bit strong, but we were definitely most certainly surprised at the number of staff that end up using this service because of the convenience. We maybe we were a little naive, but we were like, whoa, wait a minute. We're seeing, you know, 30% of our patients are staff members. And then we start talking to them and they're like, well, there's no subs, or they're hard to find. You know, I can't take off and go to my such and such because I only have 45 minutes for and they start listing all the reasons that you guys know of. And we said, wow, okay, well, that makes a lot of sense. So if you want us to see them, we would love to see them. If you don't, then we won't.
Trevor, I just want a little clarification. For instance, Lori, I don't believe they have a school nurse at Caney. So would one of their secretaries be able to do that telepresenter?
So we have our experience with somebody who is not a medical person, and it doesn't have to be someone who's when I say medical person, they don't have to have like a doctorate degree. I mean, they don't have to have that level of experience, but they need to have some medical experience, and they need for that medical experience to be something, and for that their position For urgent care, primary care, and behavioral medicine, they need their primary responsibility to be school nurse or telepresenter. We have tried in the past with secretaries, and generally it's been in smaller districts, where they say, well, we don't have a school nurse, kind of what you said, we don't have one, we have a secretary. Okay, let's try it. And we tried it, and then the utilization just is not there. The students just aren't seen because either the secretary is uncomfortable with doing it because they don't have any medical experience, or they do have medical experience because they're a retired nurse and they say, hey, I know how to do that, and that's great. But their secretarial responsibilities keep them from being able to spend the 20 or 30 minutes to do a visit for a strep throat or a COVID test or a lice deal, because they can't be away from their secretary's desk for 30 minutes because there's 15 phone calls and 3 kids came in that need to call home, and et cetera, et cetera, et cetera. And so what we've found, we did it 2 or 3 different times, and we just realized that it just doesn't benefit the school the way we all hoped it would. And most of those schools have said, hey, when we get a school nurse, we're going to have you back. Or, hey, this didn't work with our secretary, we're going to put this school nurse in our budget for next year, and can you stay? And then when we get a school nurse, we'll turn it back on. And the answer is, yeah, of course we can stay, and we'll just turn it back on whenever you get a school nurse. So for the folks in Caney, if they don't have somebody who's dedicated to that, it's going to be very difficult, if not impossible, to do the urgent care and primary care and behavioral med visits in our experience. The therapies, now we think the therapies, once we get an established therapist that knows their student, they are the telepresenter, and we don't, and the secretary could be the person, because they're going to just do a little bit of light traffic control with the student and the therapist. But if we're going to do urgent care, primary care, and/or behavioral med, we don't find it works.
We kind of have a unique situation. She is the secretary, but it's in a main office with another aide in the office. And she also is a first responder.
Mm-hmm.
And so we have somebody that can take over those duties when she has to be called out. We have a total of 268 students pre-K through 12th grade.
Yeah.
We wear lots of hats.
Yeah.
We don't have a school nurse. As far as anybody else with a medical background, she would be the closest thing to the person that'd be the best fit for this program. So would you have a problem with us trying that?
No, I mean, a first responder would be, as I describe it, they're kind of massively overly experienced for it, which would be great, because they're going to be a great telepresenter for our provider and be able to give great feedback and know things inherently because of their training. And so as you described it, Lori, that you kind of have 2 people up there, and that the first responder would have the flexibility to step away and do all the visits that are needed, then that's a scenario where I could see it working.
Okay.
As long as that's the process. Because if that changes and the other person, like, I'll just give you an example. If that other person that you have up there quits or leaves, and then your first responder is the only person up there, what you guys will find, and we send this out every month to you guys on the number of visits you guys are seeing and the types of visits you're seeing and what your nurses are seeing. What you'll see is you just see a decline in usage to 0. And then you would look up and go, well, we'd like this, we have a need, but we're not able to facilitate it. And so you would look at me and say, well, it's not really working. We'd have to agree. Yeah, you're right. So I'm just kind of looking ahead a little bit from our experience and just trying to share a little bit of that with you. But if what you guys have is what you described, then that could work really, really well.
Okay.
On the telepresenter being a school nurse, do they need a specific room, a specific size room for the program and the things they'll be doing?
That's a very good question. They do have to have a room where we can shut the door. There has to be privacy for because I need you guys thinking about this this is a doctor's visit, all right? Mm-hmm. This is just like if you go to your doctor. They have to have a door we can shut and secure to be able to do the visit. Size is not important. The equipment that we have is minimal because the scope of practice that we have is very narrow. We're obviously not doing surgery. We're not fixing lacerations. That's not what we're doing, right? And so The equipment we have is minimal, and it fits in areas. We've done rooms that were 5 by 5, and we've done rooms that are 25 by 30. I mean, we've had some big rooms, and they said, hey, we're not using this room. Can we have the nurse's room being here? And they start piling stuff in there, and great. So we're flexible. We just have to have a room that we can secure, and shut the door to do the visit. If one of the things is and if we share this, we can share this document with you. For instance, if we do, we have districts that want to do urinalysis, UAs, right? If that's something that you guys would want to do, we would have to look at, okay, your space that you have your nurses in, and in relationship to a restroom. We have one district, they want their high school. They want us to do UAs in their high school. And okay, great. Talk to us about this. We start talking about it, and their nurse's room is like, 70 feet from a nearest bathroom. That won't work because the patient is going to have to carry their urine all the way down the hall, and they're going to trip at some point, or someone's going to bump into them, and they're going to spill it on the ground, and it's going to be a mess. And we're going to have biohazard cleanup, and we got all this stuff we got to mess with. So there has to be those are kind of things that we would talk through once you say, okay, this is the room we want to use, or give us an idea of what kind of testing you want to do, and then we can kind of talk about what the setup would need to look like for it to function and work for you guys.
Sure.
Are there any other questions or comments for Trevor?
So if pediatricians come on board with this, do they do their billing, or do you do their billing? Does Team Clinics do, who bills?
So we can do it both ways, or I'm sorry, not both ways. We can do it either way. Meaning, if we have a pediatrician group, so we built our platform to where we can what we call white label it to the local pediatrician group. They would rent it from us. They would use our platform, our registration process, and all those kind of things to do the pediatrician work. And they would be your point, they would be your point people. You when you logged in, you would see them there. And then they would do their own. It would be their own thing. It'd be their own billing. Everything would be that they would own all of it. That's kind of the way we describe it. They would own all of that. That's one option. In those situations, we haven't had this happen yet, but we anticipate that we have a pediatrician that wants to do that, but you guys also want to do behavioral medicine. We don't expect them to have the psychiatrist that works for them or is contracted with them. So in that scenario, if you said, well, we want pediatrician and we want behavioral medicine and we want, let's say these three things, we would talk to the pediatricians. Okay, well, either you can go find the psychiatrist and you're going to provide all those services and manage all of that, or you would contract with us directly. We will do all of that. We'll go find all the people that we need. And then when you see a patient, you're going to get paid because we're going to do the billing, and then you'll get paid. We work that out with the pediatrician and what their contract is. And so we can have that conversation around what's the best way to serve you guys and how to do that. But we can do either way. We anticipate kind of broadening the pediatrician question to like the local hospital system.
Mm-hmm.
A lot of hospital groups do telemed, but they do it a little differently. They contract with a company who does a FaceTime or Zoom like this, and you just see them, and which is great because it's better to see somebody than nobody. But there's no diagnostics, meaning there's no testing. You can't test them. You can't look in their throat. Maybe you have your phone and you're trying to use your flashlight to look, but there's no real diagnostics having no medical equipment that's being used. You can't listen to their heart and lungs. You can't get their height. You can't get their weight. You can't get their blood ox level. You can't get. Our system is different than that. Ours, we have all of that equipment there at the district, and so we get all of that information, have a more well-rounded or comprehensive visit. So, but we do see where the hospital systems, because we've been asked by several in the rural areas about, hey, can we do your stuff? We say, great, we'll just rent it to you. We'll sell it to you. You use it and go contract with your schools or whoever you're going to do, and you can use our system, no problem, and you do the billing and you do all the stuff. So far that just hasn't happened, but we do anticipate that being an option, and we think that'll happen as we kind of expand.
Mm-hmm.
All right. Well, if anyone, if no one has any questions, we can maybe wrap this up. And Trevor, I can tell you know about the realities of school-based health services, and that's evident with all of the head nods that I'm seeing on this meeting. And so I really appreciate you giving us your time today and having this meeting with us.
You're very welcome. You're very welcome. Happy to do it. And if you guys feel that our services can help you guys or you have more questions, please let us know. And we'd be happy to share as much information as we can with you guys and answer any questions and go as fast or as slow as you guys want to go. Shana, do you mind? You have my contact information and Melissa's, yes?
Yes.
Okay. Do you mind sharing it with everybody that's on the call? And if they want to connect with us, they can?
Sure.
Okay, great.
Do you have any follow-up items or resources you'd like for me to send out to them as well?
We will, yeah, Melissa, let's make sure we send Shana the team update that I sent out on Friday, the letter, and so that they can see that. Kind of gives a little bit more, it's in writing at least. It's helpful to maybe kind of read some of that, because there's some things I didn't mention that we're going to start doing some chronic condition monitoring and services that we can do to help support people who have chronic issues. We kind of talked a little bit about that, about behavioral med, if somebody has that monthly, but even there's kind of expanded beyond that. For instance, you guys, the special dietary exempt form when a student has a specific diet that they have to have, and for you to guys get reimbursed by the USDA, you have to have the form filled out that says they have to have the special diet. Otherwise, you guys just pay the 2.5 or 3 times what the normal meal is. Well, those kind of forms we can facilitate that. We can fill those out. We can see the student. We can take care of that and get those kind of things. So that's in my letter that I talk about to try to give you guys some ideas around, okay, how can we use this tool? So that's in there. So we'll send that, and then I think that would be probably the best thing to start with. And then, yeah, I think that's probably the best thing to start with. And I think if there's questions beyond that, we'll just jump into it with them.
All right. Thank you so much, everyone, for joining us today.
Thanks for putting it together, Shana. Thanks, everybody.
Thank you.
Thank you.
Bye.